Today, I'm going to be discussing our study linking autoimmunity and KRAS mutations in patients with CMML. Chronic myelomonocytic leukemia, or CMML, is a rare hematologic malignancy that has features of both myelodysplastic syndromes and myeloproliferative neoplasms. CMML is associated with autoimmune disease in about 20 to 30% of patients. There are several genetic mutations that we see in patients with CMML, and one of the genetic mutations we see is RAS pathway mutations. RAS pathway mutations are typically associated with a more proliferative disease phenotype, but they're usually coexistent with other mutations in epigenetic modifier and splicing mutations. So it's rare to see RAS mutations in isolation in CMML. So in this study, we present a case series of 4 patients with CMML who had RAS mutations, specifically KRAS mutations, and had a multitude of autoimmune diseases. We discuss how these patients CMML develops and the relationship between KRAS mutations and autoimmunity. Interestingly, there is a clinical entity known as RAS-associated leukoproliferative disorder, or RALD. And RALD actually is characterized by autoimmunity and KRAS and RAS mutations. But the difference is RALD is really considered a non-malignant condition. There is overlap between how CMML presents and how RALD presents in terms of monocytosis and splenomegaly, but there are different features for both disorders. We did rule out RALD, in our patients to the best of our ability in terms of their bone marrow biopsies showing dysplasia, which is more consistent with CMML, and also them lacking the characteristic CD20 B-cell lymphocytosis that you see in patients with RALD. So interestingly, these 4 patients, 3 of them had isolated KRAS mutation, and that is very rare in CMML. 3 or 4 patients had are actually females, which is interesting because CMML has a predominance of males, about 2 to 1 male predominance in CMML in general. And the other interesting aspect of these patients that we identified is that their disease seemed to be pretty indolent, as evident by the fact that they're all alive at this time. So we question whether there is a subset of patients with CMML who have RAS pathway mutations, often isolated RAS pathway mutations, autoimmune disease, and indolent courses, and whether these RAS mutations in autoimmunity and CMML are more associated with the female sex and kind of show a more indolent disease course. So, of course, this study has to be verified and further looked into in large data sets of patients with CMML from multiple centers, because this disease is a pretty rare disease. So kind of seeing these kind of trends will require collaborations and multiple centers to look at their data sets. But we think this is an interesting observation in this disease group, and linking the autoimmunity with the more indolent disease course kind of mirrors where MDS, myelodysplastic syndromes, have been linked with autoimmunity and more indolent disease courses in patients who have autoimmune disease and MDS. I think this is important for patients with CMML because we need to make sure that we're profiling these patients in terms of their genomic alterations and including RAS pathway mutations and in the genetic profiling of these patients, and then paying attention to possible kind of autoimmune diseases that could co-occur in these patients with CMML, and then trying to rule out other disorders like ALPS and RALD as well.